institution that wants to merge with the great St. Vincent. I simply do not believe it. The State Department of Health wants us to believe it because they have created an equation where that is the only answer we would get. We're not going to fall for that bait and switch. We're not going to fall for this trick that Continuum is the only entity out there. We're going to say tonight, and we're going to say it over and over again, the only plan that should be considered or ever approved by the state is one that keeps our hospital and our emergency room open. At times, government wants to make things only about the bottom line. Only about getting the balance sheet to zero. That's what we may see to make sure it doesn't happen here. Because if this balance sheet goes to zero, that means there's no hospital on the lower west side of Manhattan. That means there's no hospital on the west side of Manhattan where we just rezoned Hudson Yards to make a new neighborhood. Who is going to move and bring their children here if there is no emergency room they can rush them to when they stop breathing in the middle of the night? No one is going to want to live in this neighborhood if we don't have a good health care institution. The other message we need to send, and maybe, with all due respect to the State Health Commissioner, as someone who doesn't live in this neighborhood, he can't understand this. See, this is part of our neighborhood. It's part of the fabric of what makes the West Side so great. It's a place that took care of people with AIDS when no one else would. It's a place that takes care of seriously mentally ill people who other hospitals turn their backs on. It's a place that still, even though it doesn't make money, says to people who are struggling with alcoholism or drug addiction, come here and we will help you start your lives over. And it is a place that never says, show me your insurance card before I will treat you. Now, a year or so ago, we heard something over and over when another different kind of an institution was about to go belly up. When AIG looked like it was going to close. What did everybody say? It was too big to let fail. Well, I have an equation for tonight. St. Vincent is too important to let close. That is our message. And don't be fooled.
And I'm very proud to be a resident physician at St. Vincent's. Since inception by the Sisters of Charity, St. Vincent's has made a commitment to our community. The commitment we've made is to provide excellent care for all of those that we serve. We fill a void. We serve the homeless. We serve those underrepresented. We serve the homebound. This is a void in our community that will greatly increase if St. Vincent's is not allowed to continue. Last week I saw a patient in her home, an 89-year-old female that I had, an 89-year-old lady that I had seen many times, recently admitted to St. Vincent's for a hip fracture after a fall. She's legally blind and she lives in the 5th floor of her walk-up apartment in the West Village, which she lived in since she was much younger. Now can't get up and down the stairs. She is part of the Chelsea Village program at St. Vincent's, which provides program provides visiting doctor services for patients that are homebound, mostly patients that would not receive medical care if St. Vincent's did not provide this service. She is one of many patients that will be affected if St. Vincent's is not allowed to continue in the form that it is now. We are committed to providing comprehensive care, acute inpatient care, and comprehensive outpatient services. My colleagues and I are committed and willing, and we are excited for St. Vincent's to continue, and we will fight for our patients.
I'll take this one down, but my patient is actually here. I'm not a politician either, I need some votes for me. My name is Dr. Jay Mather. I'm a member of the Committee of Interns and Residents, and I speak for everybody, all us interns and residents. I say that I'm proud to serve this community. I'm proud to be a part of